Hello, welcome to this lecture with the topic of the use of virtual reality and augmented reality in oncology training and treatment. So before I start with the lecture, just a little bit about me. So I will be the lecturer of this class, and my name is Mexhid Ferati. I'm an associate professor at Linnaeus University in the south of Sweden. I work at the Department of Informatics, so obviously my field is in IT, information technology, more specifically in human-computer interaction. And you can read more about my activities and the courses that I teach and my research on the link that is posted here. So let's take a dive on the topic. The outline of this lecture will be that first I will give a brief introduction about virtual reality and augmented reality, because these might not be like known concepts for some of you, or even if you know, you've heard it maybe in the media or in the news, perhaps you don't know the difference with them. So I will take a bit on lecture on that, and then I will move into how this can be used. These technologies can be used for patients. Then I'll move how this technology can be used for doctors and physicians, and then at the end we will conclude this lecture. So we are mentioning virtual reality and augmented reality. So what is the difference? Many people think these are the same thing, but actually there is a substantial difference between these two. First, let's start with augmented reality. So augmented reality, you typically need some kind of a device, in a sense of you need a tablet or a smartphone. Well, essentially every smartphone today has some kind of a AR capability. The idea is that the user is immersed in the mix of realities, so that the user can see the reality, can see the outside world, but then on the phone they can see the virtual world. So it's like a combination of the real world and the virtual world, and the user can interact with both of these worlds, but he can also see the difference between these two worlds. And as I said, this can be, most of the smartphones today and tablets can have this capability. And actually there are like apps that you can install that you could see and explore for yourself AR. For example, one is the IKEA app. If you download that and you want to look the furniture, you can actually set the furniture at your home and you can see how does it look in the setting of your home, that couch or any kind of furniture. On the other side, we have a virtual reality. And in this, you typically need some kind of a goggles where you immerse yourself and you don't see the reality anymore. So you are entirely within that virtual world. And it's difficult, of course, then to differentiate between the reality and the virtual reality, because you are within the virtual reality and you don't see the reality itself. So in order to do this, you definitely need some kind of goggles. For example, one is Oculus Go that you put and then you explore and you see with that, the virtual reality that has been developed. The VR and AR actually have been in the entertainment industry for several years now. For example, here on the left, we can see an example of virtual reality where the person has these goggles and he's playing hockey. And so you can see here in the screen in the hockey. So this is what the person sees here. But then as he uses that kind of paddle, that sort of has an effect on the interaction with the virtual environment. On the right here, you can see a very famous game, and perhaps some of you have played it, the Pokemon Go, which is an example of augmented reality, because you can see the reality as you see here. You can see the bridge and pretty much everything what you see with your eyes. But then on top of it, you have the animal. So that means that you are seeing both worlds at once. So again, hopefully this now brings into you the difference between the VR and AR. So let's look at because the VR and AR actually can be used in the medicine, and there are some examples that how this technology has been used in medicine, especially for patients and doctors. An example on what VR and AR can be used for patient is to improve the patient's emotional well-being. As we know, usually the procedures within the oncology are they take a toll on the emotional well-being of the patients, and with the use of this technology, we can alleviate some of that pain from the patients. And so essentially, it contributes to lessening cancer-related psychological symptoms. And then, of course, it's beneficial during the chemotherapy, and then it helps in reducing procedural pain. So, for example, there is a study that you can read more if you want by following this citation, and in which it is shown how VR could be combined with music therapy, and then it can help to distract the patient during the process of the chemotherapy to ease anxiety for the patient, but also improve the mood state for them. So it's an interesting study. Perhaps you can read it more details and get more information about it. There are actually cases when practically chemotherapy, the VR has been used in the chemotherapy. Such an example is the Christiana Care, which again, the patient used the VR to immerse themselves in places outside the cancer center, such as in the beaches, forests, popular destinations. And in that sense, when the participant or the patient was immersed in this VR virtual reality, they could decrease the anxiety that comes with the receiving chemotherapy. And here is a really short video that perhaps we can watch together now just to learn more about this.
We recognize the positive potential of virtual reality and use the technology to ease suffering and create a much more positive experience for patients who are undergoing cancer treatment.
When you put the goggles on, you're immediately taken out of this infusion room. You don't see the IV poles, and you don't see other bald people, and you don't see your port. It's a really nice option to give you some relief of that, because that's something that you have with you everywhere you go. But this gives you a chance to be like, hey, I'm in this great place, and it's a relief, to be not confronted with it all the time.
So there you go. There was a really short example of how the patient actually experienced the virtual reality, as she explained and also saw in the video. The virtual reality takes the patient in different, settings so that they can immerse themselves and forget about the process that she's undergoing with the chemotherapy. So we saw that how the VR and AR could be useful for the patients. However, I think this technology can be used also for doctors or physicians, and that can be in the role of assessing cancer, but also in terms of training and recreating realistic clinical environments, and of course in surgery. So let's see some of the examples. For example, this study here, again, you can follow this citation and you can read more about this study, but essentially it shows a combination of three technologies. One is the 3D printing, where these researchers have printed this type of I think it's a kidney, and then they explored that using AR and also a VR, and the whole idea was to assess and manage this kidney and prostate cancer. So again, it's an interesting study that shows how different technologies can be used in order to improve this the management of these type of cancers. The training, of course, these technologies have a great potential in terms of providing training for nurses in giving first cancer the treatment. It's a known fact that especially the new nurses, they could be anxious about the process, and so providing them within a virtual environment where they can test themselves, they can do, train themselves without actually having any impact on real human beings. I mean, that's a really good way of training and even alleviating that anxiety that comes with the process. So in essence, this system could simulate a clinical setting in which these nurses can use these VR tools and the interface to administer and give the medications to these virtual patients. So it's not a real patient, but a virtual one. And again, just practice this process. And again, the goal is to experience the experience is to increase the nurse confidence. So that means they will become more confident when they deal with real patients. And of course, they will I mean, when they do this multiple times, they gain, as I said, lose that some of that anxiety, so they become more confident. And then when they actually interact with a real patient, they will be performing better. There are studies done in this, and they've seen that based on those studies, the nurses have reported that after using this VR, they were very positive, meaning that it helped with their training process. So I think here there is another video that shows a bit of like how the VR can be used in training. So let's watch it together.
When launching our blood cancer drug in the UK, it became apparent that there was a need to build nurse confidence around the administration of it and how to manage infusion-related reactions. This led to the creation of our nurse training simulation to build a virtual chemotherapy clinic. In a safe virtual environment, nurses are able to build their experience of managing a range of treatment-related reactions. The results are clear. Nurse engagement increased, with in-call time rising from 30 to 180 minutes. 100% of nurses surveyed stated the VR training program would help in their clinical practice and has better prepared them for treatment initiation. With 85% of target NHS nurses having been trained already, we ensured a high level of confidence in the administration of our drug by creating as close to real-life scenario as possible.
Okay, so again, we saw really good, how this virtual environment could be used in training. I mean, it showed how everything is kind of prepared. I should say probably here that developing such virtual reality is an immense work, and then developers really spend lots of hours to recreate that simulation. So that's why this is another challenge when we talk about the virtual reality as a technology that can be used in different contexts. And there is an example here that, especially if you follow the link here below, that the VR was used actually in lung cancer operations. The article shows that the surgeons could operate in a much more targeted way and save healthy lung tissue as much as possible. So obviously it helped with the process of the surgery. They report that they already used this in 20 patients, and with this technique. And in the future, these surgeons have reported that they have the plan to develop these VR techniques for operations on other organs besides the lungs. So in essence, we saw that how VR and AR could be used or are already being used in some settings. But when it comes to geriatric oncology, I think it's good that we already have the VR and AR validated and integrated in learning and surgical procedures. So this gives us confidence that VR and AR actually has a great potential to be used also in the geriatric oncology. And of course, it's a means to offer medical students a very safe environment to experiment and learn without any side effects, and also to boost their confidence, so that when they get into the real world, they are more prepared to actually conduct these processes. And geriatric oncology would benefit, of course, from the integration of VR and AR technologies, because in a way it's a cost-effective method that enhances student training, but also could enhance greatly patient treatment. So with that, I think this is sort of an overview, a very brief overview of the potential of this technology and how this can be used within the field of geriatric oncology. I think if you follow this lecture, you would probably now get an inspiration on how this could relate to your experience so far. So perhaps like an homework for you could be, if you want to test yourself, and is to think about writing a 500 words essay on how you envision the use of these technology will impact the field of oncology. Of course, you can start here by reflecting on your experience. I'm sure you all have some experience of some sort, and you can relate how this technology could be used to, maybe you can think back about the situation where you think this technology could have been a really needs or helping you some way, or perhaps if you have a vision on how this can be used in the future. You can also base this essay on your experience, but also you can mix this with and get an inspiration from already published articles similar to those that are included in this lecture. So perhaps you can read some more articles, you find interesting articles, and then you can develop this homework. So yeah, I mean, this concludes this brief lecture, which was again the intent to give you a brief overview of how the technology can be used within the oncological field. If you have any questions or comments, or just feel like you want to reach out to me, feel free to email me. The email is shown here. It's my first name, last name @lnu.se. So good luck with your studies, and we'll be in touch. Thank you.